I don't have any gigs scheduled.
Okay.
Because I'm having surgery in December. I decided not to book anything until like probably April.
Okay.
To make sure that I've recovered before I do anything like that.
You're having surgery for dystonia?
Yes. Yeah.
So we may have to talk again if you'd be willing.
Oh, for sure.
Yeah.
Absolutely. I'd be happy to do a follow-up.
Hello and welcome to Friends with Deficits. I'm your host, Adam Sultan, and that is my next friend, Kate Howard. Kate's a songwriter and singer in Austin, Texas, and she's going to tell you a little bit about her dystonia, how it came about, how she's dealing with it, and what it is. So without any further ado, here's my conversation with Kate Howard.
I go to gospel brunch every Sunday. They've been doing that for years, but that's every Sunday. They have a band, Scrappy, Plank, John D. Graham, John Green, and Sela are the Purgatory players.
Right.
And then they play for an hour, and then in the second hour they bring up guests, if there are any musicians in the house who they know. And I'm there every week anyway, so they'll call me up and I'll usually do a funny song.
Are most of your songs funny?
Most of them, yes.
Everyone I've heard of it say.
Yeah. Most of my songs are funny and in an odd sort of way. You know, my background is in theater, not as an actor, but as a playwright. So I've written a few one-acts, a dramatic monologue like a tearjerker. It was a eulogy. And I guess you would call it a dramatic comedy, this full-length play that I did a few years ago. And all of those are autobiographical. So it took me 50 years to write my first song.
Wow.
And
hear
then,
that, folks.
and then a week to write the next one.
Yeah.
And I've since written, I'm still talking about actually compiling a catalog whereby I know exactly how many songs I've written, but it's around 275.
That's amazing.
It stuns even me.
Yeah.
You know, not all of them are complete. A lot of them suck, you know, but there's enough for several albums. So one thing that's interesting about my condition is that it hasn't affected my music nearly as much as I thought it might. So my condition is a neuromuscular condition called dystonia. And there are lots of different kinds of dystonias. The kind I have has got a couple of fancy names. There's cervical dystonia, cervical meaning spinal, cervical spine, or spasmodic torticollis, which sounds like a pasta dish that kind of gyrates, you know.
But not so delicious.
No, not at all tasty. Yeah. And I didn't even know that I had it for a long, long time. I first started having what I found out later were symptoms of this condition in the late 80s when I first moved here. But I thought they were just like nervous tics. They were just annoying, you know, and weird enough. I didn't worry about it too much. At that point it wasn't painful, but it became extremely painful. But I thought it was, I didn't know what it was that was causing what was happening. But then when people started saying, oh, well, this is all in your head and this is stress related and, you know, you just need to calm down. You know, you just think too much, you just worry too much, and that turned out to be bullshit. It was all in my head, but neurological, not psychological.
Right.
It's a huge difference. Yeah. So, and there's nothing that I could have done in terms of, I could have kept my stress level down, but that wouldn't have cured it.
How did you come to a point where you got it diagnosed?
I had been going to like alternative medicine and just, acupuncturist. That was just making it worse. And my acupuncturist, who's brilliant, he didn't know what it was. One of the things that happened was I'd gone in for cataract surgery And I asked my eye doctor, what does it tell you when one eye is always dilated? And he said that points to something neurological. Well, a person who has great insurance and a steady job would have just gone to another doctor and said, hey, something neurological is going on. I was frozen into inaction. I was terrified of finding out what was going on. So I didn't do anything for, at least 6 months.
Did that doctor refer you to anyone or recommend you see someone?
He didn't.
He just answered your question, that was it?
He was a surgeon. He was an eye surgeon. And he's just, that points to something neurological. And then just didn't,
And billed you and left. Okay.
Right, yes. He's since retired, so it's not like I would go back and sue him or anything, What happened was people had started mentioning dystonia to me and torsion. Like, why do you have torticollis was what my allergist asked me one day. And I said, I don't know what that word means. What does that mean? It's like a wry neck, a twisted neck. And I said, I have no idea why I have it. And
did you notice that you had it?
Oh, yeah,
okay.
Absolutely. What I didn't notice was that my head was bobbing.
Okay.
And at that point, it was bobbing a lot. It was like a bobblehead doll. Wow. And it was hard. I was a technical writer. It was hard to work because I was twisted up like a corkscrew. And I had to turn my body around in order to be able to face the screen. Did
you notice it was happening, or was it kind of like you get to certain plateaus where you're like, okay, this is like a milestone?
I knew it was happening, but I didn't know it was causing it, and nobody knew, and I'm a single gal, and my family they're geographically close to me, but we don't see each other every week or anything. Mm-hmm. They knew stuff was going on, but I had all these other health issues going on as well, severe food allergies and vertigo and all kinds of other crap. And we thought that it might be related to all of that, but what ended up happening was I started doing internet research, like torticollis. What does that imply, And I started learning about dystonia. There was this woman who was going on the Oprah show who had this condition called dystonia. And I saw her and I was like, oh my God, that is like a really severe case. She was having to wear a helmet practically. Oh. She was bent over 90 degrees. She lives in Dallas and LA. She's a movie producer. And it wrecked her life. And medication didn't help. The crux of it was, when I saw her and heard her talking about it, I thought, well, this is what I've got. And I'd also seen this movie on Independent Lens on PBS called Twisted by this woman named Laurel Chiton, who also has dystonia. In her case, she wasn't born with it like I found out that I was. It just presents later. She had a traumatic brain injury in a car accident, which can also cause it. The film, she followed these other people who had dystonia and talked about what their experiences were like and what their treatments were like and things like that. And it was because of that I found the Dystonia Medical Research Foundation, which is how I found my neurologist who diagnosed me. So from the time that I originally started having tiny symptoms, like if somebody were to pat me on the head, mm-hmm. I would blink. Or if I got nervous when I was talking to somebody, my head would just drift off to the left. Okay. Weird symptoms that you don't think are much of anything. To the point where in the early to mid-aughts, I was twisted up like a corkscrew and in constant pain, and my head was bobbing all the time. So 20 years, really gradual progression, constant pain. I then got a diagnosis. They put me on medication. Within a week, I could tell a huge difference. Like the pain was gone.
What kind of medication?
I think it's called an agonist. What it does is it blocks the signal from the brain to the muscles that causes the muscle spasms that result in the tightening and then the twisting of the body. It's carbidopa-levodopa, so basically dopamine.
Mm-hmm.
And when I first started on the medication, it made me violently ill. We had to modify it. It took months to get the right dosage and the right medication. I've changed medicines a few times. Dystonia is the physical part of Parkinsonism and several other neurological conditions, like people with cerebral palsy, how their limbs sometimes will curl up, or people with Parkinson's, the head bobbing, the tremors. Those are all dystonias. So it's just the physical part of it. So I was taking something called Requip for a while. That's a brand name of a medicine that people with Parkinson's will often take. Mm. But I don't have Parkinson's. I just found out definitively that I don't have Parkinson's. It's just the dystonia. There's no cure, there's treatment, and one of the treatments is this surgery that I'll be having, which is called deep brain stimulation, and it's kind of cool, and it's a little scary.
Is it brain surgery,
It's brain surgery. So my brother says, you'll be a semi-cyborg, which is pretty cool.
Who doesn't want to be a cyborg?
Right, and it was in the movie Twisted that I saw a woman who was twisted up like the woman who had been on the Oprah show. Mm-hmm. Well, she had this deep brain stimulation, or DBS surgery, that I'm having. They implant a device that's like a brain pacemaker. It's like too many nervous impulses are going to the body, and the body freaks out and spasms, the muscles spasm, and then they tighten up, and then they twist. And that's what causes the torsion in the body. So they implant a device, this brain pacemaker, that's connected to electrodes in the brain. Once they've done that, they turn on the device after a month, and then they calibrate it to make sure that they have the best setting possible. And then the neurologist who does the calibration then will hand over the remote control to the patient, and then they're in charge of their own, yeah.
Brain implant.
Yeah.
Wow.
Well, it's electrodes in the brain.
So
but the implant is a device that's going to be in my abdomen. So they're just electrodes that are attached to leads that are like thick hair. Those leads then are connected to the device, and the device is what's calibrated. I have a couple of friends who've had the surgery, one for Parkinson's and one for dystonia. And they've each told me about situations where the settings were off and they just felt like something is not right. And they just contacted their doctor, and the doctor said, okay, we can adjust for that. Now, this one gentleman who had the surgery 2 years ago, my friend Anthony, there's a battery in the device, and of course has a shelf life, you know. Mm-hmm. And so his battery was running low. So he was running low. He was low energy. He's someone who had it for Parkinson's. So he just went in and had day surgery. They just went in, took like 45 minutes. They changed the battery, which is basically putting in a new device.
Wait, but is that in your body, or is the battery just in this external device?
The device is, well, in his case, I think it's in his chest. Okay. So they replaced that. There are different battery lives. There's a 2-year, I think it's 2-year, 5-year, and 15-year. So for starters, I'm going to start with 2 years, just because the technology behind all this is advancing so rapidly that it could be they have in a couple of years an even better device. Mm-hmm. But if I have like a 5-year or a 15-year whatever device, I have to wait that long before I get it changed out. Right. So in the movie Twisted, there's this young woman who'd had the surgery, like I said, and she had her remote control for the device. Mm-hmm. and turned it off. And she folded up.
Wow.
And then she turned it back on and she just went right back up again.
That's crazy.
It's stunning, really. And I'm grateful to live at a time in a country where there is this technology, and in a city where there's a doctor who's done the surgery like 600 times. So I feel confident going in that I'm going to get the best result possible. Also, the hospital has a dedicated MRI machine for this surgery. Can I get a little graphic?
Sure.
So they're going to drill a hole in my head. I'm going to be awake during the surgery so that they can test my brain function.
Do you know if most brain surgery you need to be awake for?
I don't know if most brain surgeries you do, but for this one, I could choose another surgeon and be asleep.
Okay.
But I chose this one because if you're awake and they can do these tests while you're awake, then they'll have a better chance of placing the leads in just the right spots in the brain. Mm-hmm. If they hit the sweet spot, then the chances of my getting 60 to 80% better, which is the promise of the surgery, are improved.
When you do this awake, are they communicating with you, or is it just your motor skills will be awake, or they can ask you to do something?
They're going to ask me questions and ask me to do things, touch my finger to my nose or do some, they requested that I not bring my ukulele in. That was an option. But yeah, this doctor has done this surgery countless times, and he told me that I'll be awake during all of it, including when they drill the hole in my head. And he said it will feel like vibration and it will sound like a dentist drill. I've been awake for 2 eyelid surgeries and 2 cataract surgeries. So being awake during a surgery isn't as big a deal to me as it would have been had that not been the case. But being awake during brain surgery is, it's a little scary.
Yeah, it's pretty weird.
Yeah. My commitment to having a better quality of life is stronger than my fear of something going wrong during the surgery.
I always imagine with brain surgery, like if you're touching any part of the brain, that it's got to contain like all sorts of information and things, so that you're like affecting like everything,
Yeah, and this is one of 12,000 reasons I'm terrified. But I also know that there are already things that are out of my control because of this. Things are already so screwed up just because I have the condition. The chance of something going wrong is so minute compared to the possibility of things going really well.
And what about as far as having dystonia? If you didn't have the surgery, does it get worse? Is it progressing to...
It's not so much that the condition is progressing as much as it is that the treatment isn't as effective. The medication that I'm taking isn't helping the way that it used to. So I'm having episodes more frequently, and they really mess with my quality of life a lot.
What do you mean by episodes?
So when I have what I call an episode or a flare-up, the first thing that happens, if it's a bad one, is I'll start crying, even if I'm not sad. And that's because and I learned this from a therapist of mine who had a patient with Parkinson's. The part of the brain that's affected by dystonia is the emotional center. So if I have an episode, as I call it, I'll all of a sudden start feeling sad for no reason. And if I can catch it, then I can, deal with it in a way. If I know it's coming on and can sort of compartmentalize my emotions to say, okay, I feel sad, but I'm not actually sad, I might cry, but that doesn't mean that I'm actually sad. It's just a brain function, you know? It's the weirdest fucking set of symptoms.
If dystonia affects the emotional center of the brain, could it not also be true that your emotional part of your brain contributes in some way to dystonia?
It's very possible. The thing about a lot of this is they can't explain it. You know, like the surgery, for example, they know that it works. They don't know how it works. They just know that it works. You know, I hadn't thought of it that way before, and I'm not sure that that is the case. And it's a slippery slope for me, just because I have mental illness in my family. So for me to come at it from that perspective is kind of scary. I have, both my parents were bipolar, and one of my sisters who passed away a few years ago was bipolar, and I have a sister who is still among the living who is bipolar as well. So I've just been surrounded by it my whole life. I have depression, I have anxiety. I'm not bipolar, but I do have this emotional aspect to this condition, and I'm so aware that when it happens, it's like, that is the dystonia. It's very clear to me now when that comes up.
Do you, since you've had it since birth, it's hereditary, I assume? Or it can be hereditary?
It can be hereditary.
And it is in your case?
Yes.
Was anyone else in your family, did they have it that you know?
Not that I know of. I think just for me, again, slippery slope. It's like when somebody is bipolar and they have children, there's a chance that their children will have the condition. And I found out when I was in my 40s that if two bipolar people have children, there's an 80% chance that any one of those children will be bipolar.
Wow.
Only 2 out of the 7 of us are bipolar. It's a fucking miracle.
Yeah.
I don't like to blame people, you know, who wouldn't have known what they were doing. And my parents didn't even know about this condition. I didn't even know about it until, you know, a few years ago. My dad might have known about it, but I don't think he would have known that it was genetic. I don't think there was enough research on it at the time. He was a doctor, a pathologist. These are all great questions, but to me, it's a moot point.
Yeah.
And I don't have kids, so nobody's going to get it from me. Yeah. And hopefully, I'll be able to educate people about it. It's one of the things that I hope to do with this podcast, you know. Yeah. As far as the other symptoms, in addition to having twisting of the body, one of the most annoying things about it is you lose control of your body. Like when I have an episode, as I call it, air quotes, for those listeners out there, my limbs will just be out of control. And sometimes my head.
Does it come on immediately?
Yeah.
Okay.
I was on the bus the other day, and all of a sudden my left shoulder just went up. And then my left arm went out as if I were doing like a bike signal that I was turning left, you know. But then it went back even further with my elbow up, and then turned back around so that my hand is like up at a 90-degree angle. My arm is at a 90-degree angle, and then my hand went into a claw, looking like I was talking to a bird puppet, you know. So, and that was on the bus. I was probably among the most normal looking people on the bus. I mean, I've seen people, I was not the weirdest person on that bus by far.
Do you drive?
I do occasionally, but mostly just short jaunts. I don't have a car, but I drive a little bit, but most of the time I'm taking the bus or getting rides from people, occasionally a ride share.
When something like that happens, can you control it with your other limb? Like kind of pull your arm down or hold it in place or something?
Yeah, I mean, that's how, when it started out, like if my head was, like my head would go off to the left, and so I would just move it with my hand back. Or if this arm goes up, yes, I can put it down, but it's going to go back up again. I mean, I would have to just sit there, you know, holding the sucker. There's a musician named Billy McLaughlin who has dystonia, a guitarist. And he talks in this documentary that he did about how everything that one might do to relax oftentimes will cause dystonia to get even worse. Like when I do yoga, my limbs are flailing all over the place. My leg will just go crazy. And it's not actually a bad thing in that case. I sometimes will do yoga to, as I call it, unwind. Because when the body is just so torqued, you know, you can do yoga and just unwind it a bit, and that helps a lot. Yeah. But I don't go to a lot of yoga classes because I get embarrassed. And if it happens in a class and I start crying, that's a whole other level of embarrassment.
Yeah.
So typically I'll do it at home, and that helps. There's a piano player whose name escapes me who was got dystonia in one of his hands. He played for 30 years with one hand. And then he got diagnosed, and he started getting Botox in the other hand. And now he can play with both hands. That's one of the treatments, is Botox, because it relaxes the muscles.
I was going to ask about that because I'd looked that up as well. Is that something that would work for you, or have you done that?
It has helped. It helped for a while, but not very long.
Okay.
It's also really painful and really expensive. And I wanted something that had longer lasting results.
Are you talking about not having the kind of flare-ups or a constant level of pain? Like, where are you at now?
Well, right now I'm not in pain.
Okay.
There's tightness and some discomfort, but I'm not having an episode. But I know that my range of motion is limited. So that affects me in a lot of ways. Like when I'm out in the world, if I'm at a dinner party, for example, I'm going to be less likely to talk to the person to my right on a regular basis because I have to turn my whole body in order to do that. It's easier for me to just sit at the end of the table where I'm facing people on both sides. So when I play at Purgatory Players, you know, John D is to my left most of the time. He's the one I interact with the most in terms of banter beforehand. It's so socially, it's awkward. There are things that I would like to be able to do again. I'd like to be able to play golf. You know, I'd like to be able to just go out for a day with friends and not be all in my head about just how weird I look, you know, because of how my frame is contorted. And also not be caught up with, oh, how hot is it? How is that going to mess with my medication? Things I don't want to have to think about. I want to just be able to live in the moment more. And also, I could probably be a badass guitarist if I had more control over my limbs. I could feel more confident about, you know, going on stage and playing a full show without possibly needing to sit down. I've been really fortunate in that I haven't had a full-blown flare-up on stage to the point where people could tell something was going on, but there have been shows which, during which I had to refrained from playing the uke, which meant there were a couple of songs I didn't get to play because I had enough trouble with my back, which would lead to trouble with my arm, that I couldn't play.
Let me ask you a question I ask all my guests.
Okay.
And you may or may not have an answer, but just basically, what would you consider the benefits, if any, of dystonia, or of having dystonia?
There actually, I can think of at least one, which is that when I'm out listening to music, which I do a lot, if there's a certain groove, you know, if the rhythm section is just spot on, you know, if it's just like, you know, Tom Pearson on bass and John Green on drums, you know, my body almost compels me to dance. There are times when I'm on the dance floor and I'm the only person on the dance floor. And it's not like, oh, that's great groove, let's dance. It's as if my body actually almost drags me to the dance floor.
As if it's the dystonia doing it?
Right. Yeah. It's like, it's so odd. It's so odd. But I just can't help myself. And it makes me feel better to dance. And the way that I dance, I can't do partner dancing really well unless I have a really great partner who knows what he's doing and is guiding me in a very particular way that's gentle enough, gentle but forceful, you know, just the right combo. But typically I dance just sort of free form, and it's kind of funky, you know, and I just love it. But I can't really control the moves all the time. But I'm rarely embarrassed by them. But it's as if I cannot help it.
Have you had that urge to dance before you had dystonia? Before you were symptomatic?
No, I was not somebody who would go out on a dance floor when I was in when I was in high school or college. If I went to a club in college, I wasn't out dancing.
Did you have the same appreciation of music back then?
Yeah, for sure. Absolutely.
That's interesting, because it seems like the same thing that you could be embarrassed by, that's awkward for you, is the same thing that's making you like get out on the dance floor?
Right. Yeah. Well, you know, there's just, when you have a condition like mine, unless you want to be obsessing about how you look all the time, every once in a while you just have to say, fuck it, this is just how it is. I mean, I could be someplace where I don't know anybody. You know, I could be in another city and listening to music, and if the groove is right, I'm on that dance floor, and there is nothing that's going to stop me unless I'm too tired.
Have you considered just dancing the night away? Just like
I just
constantly
love,
dancing?
Well, yeah. I mean, there's actually a dance therapy for dystonia.
Really?
Yeah, this guy in Canada developed it. There's a video, and I've thought about that. But then it becomes work. It's part of the therapy. It's physical therapy that you would have to keep up with. And I thought about it long and hard. And I have that discipline about some things. And I know that if I decided not to do the surgery, that would be the next option I would explore.
Yeah.
But when I found out that I could get 60 to 80% better, and that my doctor had the success rate that he did, I thought, well, you know, I'd like for dance to just be the fun thing that I do. And I'd like to focus my discipline on songwriting and on performing, and just have the condition taken care of as much as possible. Does that make sense?
Yeah. Well, I hope that part doesn't go away.
Oh, I hope so too.
It'd be a shame you're sitting down and you're like, what's going on? The music's great. I'm not dancing.
Yeah. I'm hoping that will stay the same.
Yeah.
You know, so I think that's the main thing. And, you know, what that does for people who are in bands, when people go out and dance, you know, people rarely dance to my music. Occasionally they will. But it's really wonderful when they do. I think that's a great gift. And also, it inspires other people to dance. There are these 2 women who got up and danced with me. You know, for somebody to just be on their own, and it's not just like bad white guy dancing, you know? So that's a whole other conversation. I'll do these bad white guy dancing alerts when I'm at 1-to-1 or at the Continental sometimes, and people will say I'm sexist or racist or, you know, bizarre. It's like, no, you haven't seen this guy, you know. But I celebrate dance as a form of creative expression. If somebody's just trying to draw focus away from the band, that's different. And that's what was happening in that case. I have a movement disorder. That's what this is called. It's a movement disorder. And one of the great things about a movement disorder, in my case, is it moves me onto the dance floor.
That's great. That's incredible.
Yeah. So.
That's the last thing I expected you to say.
Yeah, I would imagine. Yeah.
There's no cure for this?
No, not yet.
Okay.
But the interesting thing about musicians' dystonia, because it's focal dystonia, it's confined to a particular body part. The research being done on focal dystonia, they're saying that's probably what is going to help them find a cure.
Oh, great.
And any research that's done on dystonia, any breakthroughs in research, rather, are breakthroughs for Parkinson's as well.
Wow.
And vice versa. There are 2 different surgeries that I'm having. The first one is when they put the leads in, and the second one is when they implant the device. They're a week apart. And then they wait like 30 days before they turn on the device.
Why is that? So it acclimates, so there's no problem?
I think it's just, your body might reject it. I'm not 100% sure.
The cyborg needs to take hold of
Exactly,
your soul.
Exactly, yes. Kate Howard, the Borg.
Yeah.
So I have this whole idea of how I'm going to, when I start performing again, like my first show, and just like silver lame jumpsuit with platform heels and an umbrella hat.
Oh my God.
Yeah, backup dancers and
that sounds pretty good.
Robo-Kate. Yeah. That's the plan.
Robo-Kate. That's good.
Yeah. So I really just think it's going to make a huge difference in my life.
I hope so.
Yeah. I just feel like one of the most fortunate people on the planet to live at a time where there's a surgery that could help my quality of life to the degree that this one can. And I'm going to say can instead of could. And that I live in a town with a music community that would allow someone who wrote her first song when she was 50 to get up on stage week after week and play a song with some of the best musicians around. It's just amazing. If I were alive during, the Middle Ages, I might have been burned at the stake.
They probably wouldn't have nothing close to that brunch.
No, not even.
They'd have you for brunch.
Yeah, and if you saw a woman who was all twisted up and twitching, yeah, I would have been branded a witch. I would have been outcast.
Yeah.
So I'm so grateful to be living when I am and where I am. And I guess how I am, because it helps to be grateful and to just be able to recognize the good in other people and to connect with other people.
Good words to end on.
Yes, indeed.
All right.
Thanks so much.
Thank you, Kate.
You're welcome.
All right. Hey, thanks for listening, and thanks to my guest, Kate Howard, for being on the show. And since we recorded this, she has undergone that surgery she described, and we'll have some information about that, maybe post a video on our website, friendswithdeficitspodcast.com. Check it out. You can also sign up for our newsletter, and if you want to help support the show, you can check out patreon.com/friendswithdeficits. As always, you can find us wherever you get your podcasts. Be sure to subscribe to us, review us if you like, tell your friends about us, visit us on Instagram, and enjoy the show. Once again, I'm Adam Sultan. Try not to get bent out of shape.